Page 4. 5.
Page 5. We are live. We're health and welfare. We're back and we're looking at, I think we're on page 6.
I think so. Okay. Apologies for the interruption. So here is, we were just going through the definitions. So
Yeah.
Page 6, we looked at the definition of homeless that was proposed, and that brings us to regional advisory councils. The change here is that members of an advisory council shall include organizations providing services to the region, the department, and representatives of the agency in each department of the agency as needed. Then a regional advisory committee may collaborate with individuals with lived experience, etc. And then added in this list is statewide homelessness organizations. And then that brings us to the chapter, the more complete version of the chapter that takes effect July 1, 2026.
Page 9.
I'm scrolling ahead to look for the newest changes. So
Yeah.
page 9, 2205, authorization process and reauthorization review. The lead-in is that a community action agency providing or causing to provide services in accordance with this chapter shall have, then subdivision 3, the capacity versus the ability to perform the services required pursuant to this section.
So, okay. What I'm going to suggest is we go through all the changes that are here, then we go through the bill with an eye to each section and what each section does, and then talk about us and have everything we want in it.
Okay.
Or and the specificity.
So then this is our reauthorization reviews subsection. So not less than every 3 years, the department shall conduct a reauthorization review of each community action agency. An organization may be subject to corrective actions by the department if, within the constraint of appropriated resources, it no longer meets the requirements in subsection B of this section or has failed to adequately meet the needs of households in its region that are homeless or at risk of homelessness. Lack of compliance may result in the department deciding not to reauthorize a community action agency. The department may review community action agency performance between reauthorization reviews and progress on any required corrective actions. That language is modified from the proposal that the department provided.
Heavy hand. I can't hear you.
That's pretty heavy handed.
Well, I know, I'm waiting for comments there, so let's think about that one. When we come back, the comment,
It's like we're making no commitment to fund them at all adequately, but we aren't willing to relinquish any control.
says say within the constraint of appropriate resources. What is that? Does that?
That concept was requested by the department because the previous language said that if the community action agencies weren't meeting the needs of households in its region at risk of homelessness or risk of homelessness. And the department was explaining that given the appropriation, that probably all of the needs of households that are homeless at risk of homelessness are not going to be
It's gonna be how to tighten the.
right. I mean, the ability to do that would be difficult. So adding this qualifier within the constraints of appropriated resources recognizes the work of the community action agencies is happening within a defined budget.
Okay. I just wanted to say, I think when I read this, the way I saw it was, this is at least acknowledging that the department is going to stay involved. And it's important for me and my community that, you know, that the department and the state still be part of all of this work. So I guess when I saw this, I was happy to see that they're still sort of actively, involved.
And we've heard that as well. That's one of the
Yeah.
constant comments that we've heard. Not to bring up tea, but
But I don't disagree with Senator Cummings either.
Yeah.
I see both sides.
yeah, both sides are there. But now we have within the constraints of appropriate resources, and then we also have the department involved. Um. Okay. Okay,
Continue? Okay. Page 11, just retitling VHART services to be VHART core services. Then in subsection B, each community action agency shall offer or cause to be offered in collaboration with community partners each of the following services. In subdivision 1A, intake assessments and services for diversion from homelessness, which shall include regional intake shelters instead of may. In subdivision E, navigation to other services and supports instead of referrals. In subdivision I, referral to healthcare assistance, including treatment for mental health conditions. And substance use disorder provided by the designated or specialized service agencies. This is replacing the whole section that was specific to the DAs with regard to providing services to the participants of this program. If that makes sense, instead we're referencing the DAs and SSAs here.
okay.
And that's it for this section. Then we come to the use of hotels and motel rooms. Page 13, annually as part of the department's budget presentation, the department shall set goals for increased housing capacity, including shelter beds, permanent supportive housing, and permanent affordable housing. In addition to proposed corresponding decreases in the use of hotels and motel rooms. And the department shall provide data pertaining to the percentage of increased shelter capacity from the previous fiscal year in each region and how that increase impacts the corresponding hotel and motel room usage for emergency housing in each region, also to this subsection, for the purpose of informing regional planning and expectations. And then in subdivision D1, if a hotel or motel is being utilized, a community action agency shall enter into agreements for the use of blocks of hotels and motel rooms and negotiate conditions for the use of blocks, including access for providers of case management services or other supportive services and strategic placements that avoid isolating certain populations.
Hold on a sec. Please. Hold on. Okay.
Okay. 2208, the duties of the department.
Let me just ask a question about that. I can see a paradox here. If we're trying to have blocks of hotel and motel rooms where common services are being offered, but then we're not wanting to isolate certain populations. For those mutually.
Yeah, a little bit.
How do we, I understand what's being said here, but we want to ensure that people who are in these blocks are receiving services and not simply being isolated from as a group, but rather isolated for purposes, not isolated, but
The concern raised was around isolating maybe like age-specific groups or groups with specific disabilities. This language is trying to meld two different sort of philosophies.
yes, it is.
One being that the department is interested in these strategic placements, the other being that they're advocates that are concerned about the isolation of these particular populations.
Maybe it's just a long sentence. Maybe we need to break the sentence in two. Or maybe we add a number 3 in this, and that making 2 number 3, but then the two things we're concerned about is way we want to make sure we have the services. But number two, we want to make sure that when we put people in those isolate certain populations, that we're not we're doing it for purposes of supportive services. We're not isolating them.
Okay.
But I see that there's a hand up.
Yeah,
Go ahead.
okay, thank you. This was,
For
for the record, Brenda Siegel and Homelessness Vermont. This was an agreement, between, I reached out, Commissioner Winters reached out to me and asked me how we could fix the language. I worked with Vermont Center for Independent Living. It was slightly different than this, but, the reason was it's not mutually exclusive. It was so that you could do some groupings, but you wouldn't isolate the populations away from other populations because that's against disability rights and against the ADA. So it's
Right,
against the law.
understood. I think that's what we're talking about.
Yeah, so just, it's not just so they can get services, it's
Yeah.
also so that they are not isolated from other populations.
Got it. So is there a way to make that another sentence, Katie?
I'll make it its own subdivision.
Okay, all right, that'll help. Thank you. Okay.
Okay. Next is 2208, the duties of the department. Changing the leading language to the department and AHS shall have statewide responsibility for meeting the intent of the chapter. And then in subdivision 6, develop and maintain standards for the 4 services listed in section 2206 of this chapter, including the operation of community-based shelters. Previously, it just said develop and maintain standards for the operation of community-based shelters, and now that's expanded to all services.
Does anything in here say they have responsibility to make sure that this is adequately funded?
Who wants to make sure that that happens?
Well,
Is it in there?
you
Oh, is it in there?
Agency of Human Services is responsible now.
Mhm.
We're taking that responsibility and we're putting it on the caps. But they're still relying on state funding. My theory is that we just want to get rid of this headache. Because every year there's a squabble over adequately funding it. Somebody in the state needs to be responsible for monitoring the program and ensuring not only is it operating well, but that it is adequately funded to operate. They may not get the funding, but they need to be the advocate. for the funding.
Would that you're suggesting is something that would go into the duties of the department?
Mhm.
Is there anything there? Well, go ahead.
I'm sorry. I think you could add something like that in subsection A.
Yeah.
Because you already have a list. They're responsible for meeting the intent of the chapter, including statewide planning, system development, and involvement of all the agencies departments. So I think you could add something there.
But adequacy of funding.
Yeah, I'm wondering how to word that because ultimately the General Assembly will be responsible for, so, maybe proposing adequate funding or,
Yeah, propose it, yeah.
okay.
Yeah, that's good. Good catch.
I was straight out of mind.
That would be on page 15 somewhere,
14.
or
I would be right. I don't know if you
of
can,
the first one.
yeah, subsection
Okay.
A. I would add it to that list.
Okay.
I'll have to play with the wording a little bit, but I can add that. Okay.
Said they need to present a budget.
They'll come in the governor's budget. And then we'll hear about it in the budget process.
That's the problem.
So some, there will still have to be that negotiation going on.
Oh, I'm
Yeah.
not thinking there won't be a
Yeah.
negotiation, but I'm thinking somebody needs to say what the real number is so it can be negotiated.
Mhm.
Otherwise, it will go the way of our other community-based services, which is inadequate funding. Exactly.
Okay.
Okay. Brings us to 2009 regional planning and needs assessment. No changes there. Reporting requirements, there have been changes. So 2210, previously we had every month and now we have honor before the last day of every third month. The department shall submit a report in consultation with the community action agencies and the statewide organizations serving households experiencing domestic or sexual violence. Then we have which committees it's coming to. Question, top of page 18. This was originally coming in monthly, so we had this committee coming to joint fiscal. And when the report became quarterly, joint fiscal dropped out. Do you want joint fiscal to drop out here, or do you want joint fiscal to be receiving these reports?
So it is quarterly.
It is quarterly.
So we'll go through the summer.
Yeah.
So I think let's leave joint fiscal in there.
Okay.
Yes. Doesn't hurt. And particularly in the beginning, we're gonna need this.
And
Yeah.
because you go through the whole fall getting cold before we get back to do anything about it, somebody should be able to monitor. We've cut Y heap and I'm waiting to see housing vouchers be revoked.
Oh, yeah.
So you could have a major crisis in the fall, and somebody should be around to
Keep an eye on it.
keep an eye on.
Joint fiscal will be there. Whether they want.
I mean, what happens if the CAPS funding gets revoked?
That's the big, for me, that's the biggest question.
Yeah.
That's the hugest question.
Well, that'll be a biggie for this, it'll be a biggie, but for this structure, but the housing vouchers
Mhm.
will be a killer for an awful lot of people.
Okay, so we're not gonna solve it here, but we will solve it somewhere.
Should we have language in here in case?
Hold that thought, but write it down.
We do not.
No, that's not something we can do. No. Okay, but we are certainly forewarned.
Okay.
Subdivision 6, you're just adding the word any before supportive services. And supportive services. Top of page 19, the number of households that may be transitioned to permanent housing in the coming months. One of the reporting requirements. And we have the regional advisory councils. This green language you have already seen being duplicated here because we're recodifying this section under a different number once the total chapter is adopted. No changes in section 5. Section 6, this is our implementation planning. And you'll notice that the 6 is highlighted. We're renumbering because the section on the DAs was removed. So this is the BHART implementation planning. This is the 2-tiered report that's coming from DCF, the first one in October and the second one in January. So this first report in October outlines all of the responsibilities or report backs of the department in this shorter term. Addition here, so they're responsible for recommending a process that the community action agencies in coordination with the department shall use to conduct regularly occurring regional needs assessments and develop future regional plans, including consideration of municipal needs such as public safety. So consideration of those municipal needs would be part of the process.
So, and in the regional planning process, we do have them reaching out to community partners. Do we say explicitly municipalities?
In subdivision 1, we say that when the department is putting together the process that community action agencies will use to conduct their regularly occurring regional needs assessment, that they have to include as part of that process consideration of municipal needs. And
Okay.
then we have
I just want to make sure it's there because of that one thing I keep hearing from a number of municipalities. That way, check here.
There's been news stories about the
It's public safety.
public safety and
Infrastructure
and they
needs.
spent at one of the motels in Berlin.
Right. I got that. I got that letter.
I'm sure.
I got the Burlington letter. I got the Brattleboro letter. I got every letter. They're all lettering.
Thank you for getting those and sparing me.
I think I replied to most of them. Okay.
Page 22, subdivision A, funds is highlighted. It had been fund, it was a typo, so that's corrected. Subdivision 5 and 6 are new, items that would be part of what the department is reporting back on in October. A timeline for the implementation of core services listed in 2206 for the first 6 months of fiscal year 27. And recommended intake and assessment processes to determine appropriate shelter type for households based on program eligibility.
That's a big change. That's gonna be huge. Hopefully it'll work.
And we have the January report from the department. In subdivision 4, instead of the expanded use of 2-on-1 within the intake system, the role of 2-on-1 within the intake system. In subdivision 5, whether access to all or some services should include an expectation regarding household participation. Subdivision 7, whether intake and assessment processes should include verification of residency, homelessness, and household income.
Good.
And then that brings us to section 7. And this is the interim and final needs assessment plan. So I updated what we're titling this so we can distinguish it from the implementation plans that the department are submitting. So these needs assessment plans are what the providers are reporting back on. So the statewide organization serving households experiencing or that have experienced domestic or sexual violence and the community action agency shall conduct an initial needs assessment in accordance with the process that was developed by the department in the previous, pursuant to the previous section. By January, the community action agencies will submit one comprehensive report, and the statewide organizations shall submit a separate report to the various policy committees and the appropriations committees, including estimated fiscal year 27 budget requests, estimated costs of administering the program, and an analysis of any hindrances to generating additional shelter and permanent housing in the region. You know, I thought I changed the word hindrances to barriers.
I
Unless
thought we had that too.
anyone objects, I don't
No,
know, but
we had talked about that in here.
okay, barriers. Okay. By April 1, the community action agencies again submit one comprehensive report detailing the results of each region's needs assessment and implementation plans, and the statewide organization submits a separate report, which shall not exceed the budgetary estimates provided in the progress report to the various policy and appropriations committees.
So, and just to be clear, the statewide organization is the Domestic and Sexual Violence
Yes.
Network.
And then we go on to list what is in the needs assessment. This language is duplicated from what's being codified in the ongoing regional needs assessment. So we've already looked at that. The community action agencies chapter is not being changed in this draft. And then the appropriation section is changing. So if you're following along on page 30. In subdivision 1, the number has been lowered by 515,000. That 515,000 is instead to go to DCF for distribution to Bridges to Health. And then we don't have any changes to our future appropriation legislative intent language, nor to our transition language pertaining to HOP. And then the effective dates, ooh, that's not good. The effective dates I've obviously struck 3. So we need a period there. Because we no longer have the quarterly reports taking effect in 2028.
Okay, and that squarely leaves the department in the transition stage, leaves the department in an oversight position again for as a transition.
The transitional language, yeah.
Yeah.
I mean, you do have legislative intent language and you have
Yes.
purpose language that says your plan is to move HOP in 2018, but thank you, 2028. But this, I mean, you will be receiving this transition
Yeah,
report as part of the
there's
budget
nothing written in
presentation.
stone there. It's just what the plan is.
Yeah.
It has to go through us.
If you chose not at that time, if you chose to
Right.
back away from that, we would probably amend some of the legislative intent and purpose language to take that
Okay.
reference out.
Okay. So now we have time
Mhm.
to go through the bill. I know there are people around the room who are excited about it. I'd like us to go through the bill so that we understand each section of the bill, how it fits with other sections. And then as we're going, and then we'll stop after each section and see if there are comments to be made here on the table and around the room. I think this is the way we're going to have to be working between now and whenever the clerk calls the roll on the bill. Okay, so what we'll skip over, can we skip over findings
Sure.
today for now? And move on to and let's do legislative intent. I think we should do that.
Okay. It is the intent of the General Assembly that unsheltered homelessness be eliminated and that homelessness in Vermont be rare, brief, and non-reoccurring. Recurring. It is the intent of the General Assembly that VHART established in 33 VSA Chapter 22 as a step towards ensuring that homelessness be reduced in Vermont and interim shelter opportunities be available to provide a stable pathway to permanent housing for all Vermonters experiencing homelessness, including safe shelter options for individuals living in unsheltered homelessness. That Vermont increase the supply of emergency shelter as well as permanent supportive housing that meets the specific needs of individuals. The community components of all shelter types are integrated in a systemic manner. That time limits night by night shelter location between interim shelter sites and other disruptions in housing stability be eliminated to the extent possible. That Vermont's emergency housing statutes, rules, policies, procedures, and practices be modeled on housing first principles where appropriate. That non-congregate shelter be used to the extent possible. And that Vermont reduce reliance on the use of hotel and motel rooms to shelter participating households and expand the use of emergency shelters throughout the state for this purpose.
Committee. Well, good for now, I guess.
Okay, subsection. Oh, section.
Already. This is our legislative intent, so I'm looking around the room at people. And say comment, you can hold your comment. We'll do this again. So just so you know that, but the key for us is trying to get people into some stable permanent housing and to reduce our dependence on hotels and motels overall. And when we need emergency housing, that we have it, whether it's shelters or others, that's all key. Okay,
One more section or subsection of legislative intent. It's the intent of the General Assembly that VHART replaces the provision of emergency housing through the General Assistance Program beginning in fiscal year 27 and the Housing Opportunity Grant Program beginning in fiscal year 28. So that brings us to the creation of the VHART chapter this year, July 1, 2025. So what would take effect this year is you'd create the chapter. You'd create the short title of program staff. The program established in this chapter may be cited as VHART or the VHART program. Purpose, the purpose of the General Assembly to replace the provision of emergency housing through the General Assistance Program established in Chapter 21 of this title and use of funds and resources previously attributed to those programs and any other identified state and federal monies to fund the VHART program established in this chapter. And I'm gonna make a change. Attributed to this program.
Where are you doing that?
Page 5, line 3,
Oh, okay.
because it used to have HOP in that paragraph too, and it will have HOP again in 2027 when we
Someday.
get to that section of the bill. So attributed to this program.
Okay.
Okay. And second part of the purpose, reduce reliance on the use of hotel and motel rooms to shelter participating households and expand the use of emergency shelters throughout the state for this purpose.
Are we where are we? Are we on number 2? Or did you just read?
Yeah, I just read number 2.
So committee, anything here? Amy, you had your hand up.
Yeah, Amy Schollenberger, VCAP. I wonder if you want to add another goal list to actually put people into permanent
Can't
housing.
hear you because I got something.
Oh, I'm sorry. It seems like one of your goals is to move people into permanent housing.
Yes.
And I'm wondering if you want to add it here so that it's not only the goal to expand shelter, but actually to move people into housing.
I'm fine with that because I think that is a goal. Does that fit with
That should be the primary.
homeless emergency? This is emergency assistance and responsive transition to housing programs. So it should say something about permanent. It is the whole thing. Good catch.
They don't exist yet, but hopefully they will. That's the
I
idea.
saw a neat program about building tiny house, small houses. We gotta have more of that. I know that we're doing them in Washington County. We need those all over there.
And modular.
Yes, a little
Yeah.
modular homes, honestly.
You're doing.
Who could be against?
There
having
is
those?
a lot, well, I've been trying to, when we become floods, rather than replacing mobile homes that don't appreciate with stick built. You walk through what's locally known as a view house. They're a little 2-bedroom, 2-bath ranch.
Yeah,
They have exactly the same layout. If you just stand to the inside, you can't tell if you were in a modular home or a double wide.
exactly.
Except that the walls aren't cardboard and the outside is timber, not tin. But they appreciate. I don't know where one of it is the foundation, and that's what the housing should be hoping. Because you can't really do a slab ranch here. Because the freezing,
Gotta have a
so you have to have a foundation.
foundation.
That's how they do housing a lot cheaper, farther south.
That might be a barrier.
Modular homes are really big in Sweden though, so
Yeah.
they've got cold winters, so.
Yeah.
They figured it out. them.
Do they do a foundation?
Okay, so we have just solved the permanent housing problem and we're gonna keep moving on and build a house. You can build a house. We should build a house. This should be the housing committee. I'm sorry.
Well, it is part of homelessness.
It is totally part, that's the whole point of this, it's about having houses. Municipalities want help, they're gonna have to help us, right? Yes, okay, back at you, all right, Katie, please go right ahead.
So next we have the definition section. At risk of homelessness means precariously housed without sufficient income, resources, or support to prevent homelessness. Community action agency means an agency designated pursuant to Title III. Community-based shelter means a shelter that meets the department's standards for the operation of shelters. Department means DCF. Extreme weather event means extreme hot or cold temperatures or weather events such as hurricanes, flooding, or blizzards that create hazardous conditions for outdoor habitation by humans. Homeless means lack of a fixed, regular, and adequate nighttime residence, facing imminent loss of primary nighttime residence, fleeing or attempting to flee domestic violence, or otherwise defined as homeless under federal law. Household means an individual with any dependents for whom the individual is legally responsible for domiciled in Vermont as evidenced by an intent to dwell in Vermont and to return to Vermont if temporarily absent, coupled with an act or acts consistent with that intent. Household includes individuals who reside together as one economic unit, including those who are married, parties to a civil union, or unmarried. Unsheltered homelessness means sleeping in a location not designed for or ordinarily used as a regular sleeping accommodation.
Okay. Definitions, any comments there? Go ahead.
Yeah, under 6, so B and C, I don't, and maybe I'd have to look to the advocates for this, but I don't know if those mean homelessness. I think B and C might be better under risk of housing on the previous page, or sorry, homelessness on the previous page.
I think you'll want to hear from Lily on this, but she was trying to take the definitions that the department uses that are based on HUD definitions and try to boil that down. Our earlier definition just used sort of the first of 4 elements that HUD uses, and she was feeling that not put words in her mouth, but this was the definition of the bill wasn't comprehensive enough to capture the full population that was receiving services for households that were homeless. So she was trying to more closely track what the definition that HUD uses and that PCF uses.
We can answer.
It's just like face and net loss sounds like you're at risk of homelessness, but you're not yet actually homeless.
They're fleeing, they could be. Might be. Who knows? We'll see, we'll talk with her again.
Really knows.
Billy knows. Nellie, do you have any? No, you'll send a,
That's my understanding.
yeah,
Lily would be able to speak in more detail of all of that, but that's my understanding. Yes.
okay. All right. Anything outside of the, around the table? Go ahead.
Brenda Siegel and Homelessness Vermont. I am concerned about the domiciled in Vermont piece. I don't know how people who have been outside for a long time really prove that. I did frequently people experiencing homelessness don't have IDs. They're not going to be able to show a piece of mail. That is very concerning to me. And it seems like at most, it should be something that is explored and reported back. But I really think that it's also, we have worked with asylum seekers, which I think the state has been very supportive of. I think that's something we don't want to,
Got it. We got it. Understood. I think this is very important to the department, and having a way of getting at that is important to us. So, good.
I'll reach out and ask.
Well,
But I mean, it is important. I know it's only 4% of people are not from Vermont.
and if it-
Okay, well, we're here.
we don't know what the number is.
Maybe,
No one has done a full measure. So we can't even debate that, but we've
Okay.
heard from
Well-
one source, it's 10 to 15%. We hear from another source, it's 2 or 3 or 4%. So we just have to assume that there are some people out there, but we're not trying to punish anyone at all.
No, but that
Understand the
may
need.
be what ends up happening here, so you
Yeah.
know, serve the folks who need it. Because of this language, but anyway.
Amy, go ahead.
Amy Schallenberger for VCAP. I did want to note it has been added to the October report. Residency has been
Yes, I
added to
know.
the October report. One thing that we raised that we weren't able to really flesh out with the department when we were talking to them is one concern that the CAPS have is that domicile be attached to the definition of household as opposed to a separate definition so that like you can't even be a household unless you're domiciled in Vermont. And so it just seemed like it was a lot in one definition.
Okay.
So that's a separate concern. We also agree with Brenda's concern.
Right, I get it. Okay, so there's a question mark there, to think about that one. Frank,
This might also be, Frank Connect with the Housing and Homelessness Alliance of Vermont. This also, I'd be curious Lily's thoughts, but also on the unsheltered homelessness definition. That's not, I don't believe, tracking with HUD's definition. And so I don't know if that was done for a specific reason or not.
I think this is the definition that came to us from the House, isn't it? Yeah, so
This
it's
is,
been sitting here for a long time.
this is the definition that Representative McGill provided.
All right, so we'll, but the domicile piece is something that sounds like it's a concern. It is in the October report. We'll just,
I mean, some people have been homeless for a long time. When were you domiciled here? I'm willing to bet if you have a lot of military with PTSD. When I was working at the adult day, it was not rare that the Veterans Administration sent somebody to Good Samaritan, which then you had to leave. I think you still do during the day. It's snowing. The guy shows up in sandals. They would just take him to Project Independence and he would spend the day. These were elderly Korean World War II veterans, but they'd stay a few days and then they'd move on, and they've been doing that for a long time. Some of them had substance abuse issues, a lot of self-medication for PTSD. We didn't know what it was. People with mental health, some of these folks have been there
yeah,
a long time. They've never had a street address. Was under the bridge now.
okay, well, that definition we'll have to sort out, I think.
Was it being domiciled?
This is a definition that was taken from elsewhere and Title 18 and modified for this purpose.
Yeah, this is,
Or is it 33? I'm not sure if it's from 18 or 33. But it's a statutory language that's used for a different human services program.
oh, so to be eligible for human services programs, yeah, I think that's. See. Got it. So it would probably be Title 33.
I have to double check.
Well, it is an issue. Trying to do, like, walk that line. Okay, thank you. Just keep going, I guess.
Okay, also taking effect this year, is the regional advisory councils. Each community action agency shall convene a regional advisory council whose membership reflects the growing diversity among Vermonters, including individuals who are Black, Indigenous, and persons of color, as well as with regards to socioeconomic status, geographic location, gender and sexual identity, and disability status. Members of an advisory council shall include the organizations providing services in the region, the department, and representatives of the agency and each department of the agency as needed. A regional advisory council may collaborate with individuals with lived experience of homelessness, community partners, state partners, housing providers, local housing coalitions, statewide homelessness organizations, providers of coordinated entry, continuums of care, faith-based organizations, and municipalities in the region served by the Community Action Agency. Each regional advisory council shall provide advice and recommendations to the Community Action Agency and its region regarding the design and implementation of the program. The work of each regional advisory council shall be informed by regional planning commission's housing targets. Each regional advisory council shall meet on at least a quarterly basis. The regional advisory council shall have the legal and technical support of the department.
Okay, is community partners? Oh, never mind. Got it. I answered my own question. Anything here, folks? Frank?
Just one flag, Frank with HHAB, I can HHAB.
I can't hear you. I got this.
Oh, sorry. One flag would be the COCs are under the May section. And I just, the CAPs have testified multiple times. They would of course work through the COCs, but we have that entire system in place now that has its own governance and trust. And we have the 11 local regional housing coalitions through the COCs, through the balance of state. We have Chittenden County Homeless Alliance. And so maybe pushing that into the shall section just to make sure in statute that the regional planning commissions are working through and with the established already existing homelessness response infrastructure.
I think the goal here is to have folks included who are actually providing services. So, and then the may collaborate are with those who are others. So we can think about that.
Okay.
What we can think about. I mean, otherwise, who would you omit from the may collaborate with section?
I wasn't necessarily thinking omitting more just in the section above where it's they shall work with regional service providers, the department include, having the COCs regional, including regional service providers, because the COCs include that, but just naming COCs in that upper part.
So the regional advisory council shall, no, not there.
It would be right here. So
Okay.
right now we have a sentence, members of the advisory council shall include. So the proposal, and the next sentence is the regional council may collaborate with. So the proposal that's being presented to you is to move continuums of care right here to the previous sentence, which is a shall.
Let's think about that. I mean, Nellie, can you get a message back about that one? But, and also Amy, can you get a message back to CAPS on that one? Because I think that might actually be something we would consider there.
I can probably answer it now. Amy Schollenberger for VCAP. I don't think on principle the CAPS would be opposed to that. I think that one concern is it seems to be difficult to schedule meetings with the continuums of care, and these advisory councils may have to meet very frequently, at least in the first year. And so I think we want a commitment that that's going to be a thing that can actually happen and not hold back the advisory councils from meeting.
Okay.
I'm sitting here listening to all of this. And I'm thinking it's a perfect legislative speak. It's like if we don't tell them exactly what to do and how to do it, they can't figure it out. I mean, I really think that the CAPS would collaborate with everybody else without us having to enumerate exactly who they need to talk to. Because then they end up we can't get all these people if some are less interested.
Yeah,
than others.
So there is a reason for leaving the continuum there.
Tell them,
So if we hear differently, then we'll just hold it there. I'm hearing you about the meeting issue. We don't need that.
just tell them to fix it. Here's us back a plan to fix it.
Yeah. Okay, but good point. Be raised. We want them there if they can get there. Okay, Sam, you had something.
Yeah, I actually talked about the regional advisory council, so it feels like the language is kind of lukewarm under section A. And it's a regional advisory council, but the members of the regional advisory council are people from the department, the agency, each part of the agency is needed. So those are all people could be way across the state or not in the regions. Not to mention, it's reflecting the diversity. Some of those individuals have to be Black, Indigenous, persons of color. you know, and if you have to find the right people, I don't know, it just feels like it's a little lukewarm and it doesn't.
It's okay. This was a recommendation from the
We
agency.
can't find people that meet that definition.
So I'm kind of agreeing with Frank a little bit here that you do need a shall include some of the other people. I don't know. Just pointing that.
What we're trying to avoid is a committee, a council that is 30 people large.
No, I completely understand that. I'm fine with like less, like 8 or less. I'm just saying that they should be local people that have an understanding of the regional needs. All I'm saying.
And represent the population mix
Yeah,
of the region.
Absolutely.
Some of our regions don't have a whole lot.
I know. Well, but this is what I think,
Sure.
Nellie, correct me if I'm wrong, and the AHS asked to be included in the shell. And so they know what they're doing there. They want to be involved across the state, whether it's up in Northeast Kingdom or Brattleboro. All right, well, this is another little spot we went back to.
It's okay.
I see that Commissioner Winters has his hand raised.
Pardon me?
Commissioner Winters is joined on Zoom and has his
Oh.
hands raised. Would you-
Oh, Commissioner Winters, didn't know you were there. Welcome.
Hi, folks. Thank you. For the record, Chris Winters, Commissioner of the Department for Children and Families. And I did want to raise my hand just to make sure you knew I was here and am listening. Sorry I couldn't be there in person, and I can, possibly answer some of the questions that you have as you go through these sections. This piece, we did want to make sure that there was a real presence of Agency of Human Services folks there. At the very least, we've volunteered Lily Sojourner to be, someone who would be present at most of these meetings. It's going to be a heavy lift, and it's going to be a lot of meetings with 5 different regions and multiple meetings, I'm sure. And hopefully there will be some ability to attend remotely. And if that's the case, we can definitely bring lots of folks to bear on this, whether it's, Department of Aging and Independent Living or Department of Mental Health, Department of Health Corrections, all the folks in AHS can actually participate. And we wanted to make sure that was mentioned in statute.
Well, it does make sense. You're meeting at least quarterly. And there are times when one topic will take over another. So not everybody and his brother needs to do that for every meeting. Possibly. Senator Douglas has a question.
Well, more of a comment. I just wanted to apologize a little bit to the commissioner because I wasn't intending to take the Department of HS out, just that we need more local representation in the shallow version to a degree. Again, not 30 people.
Yeah, thank you. That makes sense.
So the shell right now is an organizations providing services in the region. So think about how to modify that to improve it. And then think about all the. Don't know how to do that. I think I agree with Senator Cummings. They know who the people are. And we don't have to micromanage it. Okay. So we're on to VHARTH.
So now we're at the portion of VHART that takes effect July 1, 2026. So you'll see that this language isn't highlighted anymore. The chapter had already been established at this point. We're amending the definition of community action agency to mean an agency designated pursuant to Title III or the entity or entities otherwise authorized by the department pursuant to 2205 of this chapter to fulfill the duties of a community action agency under this chapter. So we know that we have language that says if a community action agency can't fulfill its duties, it could be deauthorized, and that another entity could be selected in its place. The reason this language is being added at this point in time is because it cross-references that language, which will not have had taken effect July 1, 2025. So we're waiting until 2205 has taken effect to add the language cross-referencing it. Does that make sense?
So 2205 takes place July 26th.
Which is why we can't cross-reference it.
We can't.
Until that date. Okay. And then we have 2204. BHearth is established in the department to provide services to households that are homeless or at risk of becoming homeless to the extent funds exist. The department shall select and contract with a statewide organization that has population-specific service experience to provide or cause to be provided supportive services and shelter to those households that are experiencing or that have experienced domestic or sexual violence. All other participating households shall be served by or through a community action agency responsible for a geographically distinct region of the state. Community action agencies participating in the program shall provide or cause to be provided supportive services, extreme weather event shelter, and emergency shelter.
Okay,
That's
where,
Sorry,
sorry. Are you on page 9?
I am now. Yep.
Okay, good.
2205 is the authorization process and reauthorization review. Subsection A, the department shall authorize a community action agency.
I just want to ask a question before we go there. So, so this is VHART, so it's Transition to Housing Program. But so far, we've only talked about, and so I'm going back to the comment previously by Amy regarding permanent housing. And this only talks about shelters. So, and it does talk about extreme weather event shelter, emergency shelter, that certainly belongs there. Should we also be putting in anything about permanent housing, or does it not fit right here?
It references providing services, and some of the services that are being provided help with the transition of a household to permanent housing.
And it doesn't say that.
It says services, supportive services.
It doesn't, but it doesn't say supportive services.
In the specific section that outlines the services provided under VHearth, under supportive services, it talks about transitioning individuals.
Okay, so I just want to make sure we're not leaving anything out. And
Let's double check when we get to that.
yeah,
that
okay.
section.
They don't provide housing. They're going to make a referral to downstream.
Got it. Navigation to it.
Application.
Okay.
2205 is the authorization process reauthorization review. One thing I'm noticing myself as I'm looking through this is that it's specific to the community action agencies, and it doesn't reference authorizing or reauthorizing the network. I don't know if that's because they will just be, I don't know if it's because there's a different process envisioned. If it's more of a RFP contract than this process for the network. If it is, then this is probably fine as is, but if the vision is that the network could be authorized and could be subject to reauthorization reviews in the same manner as the CAPS, then they should be included in this section. So let's read through it and you can percolate on that. The department shall authorize a community action agency to serve or cause to be served households that are homeless or at risk of becoming homeless in a geographically distinct region of the state if it meets the criteria in this section. If a community action agency cannot fulfill its responsibilities under this chapter, the department shall work with other community action agencies or other appropriate community entities to ensure there is not a gap in services in a community action agency's region. A community action agency providing or causing to provide services in accordance with this chapter shall have existing or planned infrastructure to support households in the region, including an established leadership team, a human resources staff, and the ability to receive grant funding and issue subgrants.
So that was the budget that we received from folks, and it listed all of those sort of infrastructure needs that they have, administrative needs that they have.
Well, that is,
Receive that budget Friday.
that's a minimum though.
Oh, yeah.
That's million,
Startup.
that was their startup cost. All this shelter, believe I heard the state had contracted, and it was an astronomical fund to set up the shelter in Waterbury last year. And you don't just set up a shelter. It takes, well, it takes money.
Right, so we added money
Have
last year.
beds and
Right.
chairs and we're charging them with doing this, but there's no,
Well, they're
you
not
know-
starting until July 26th, so this is all getting ready to begin, to launch, to commence, to go forth.
okay, so when July 26th, so that's a year from now.
Yeah.
So when they come in with their budget, are they coming in with a budget next year, which would include the cost of setting up
Well,
shelters?
let's go through the bill and we'll see some of that. There's $3 million in the bill here for shelters. We don't know, we'll have to ask the department how that's gonna be.
It tells how much the state spent to set up. I think there were two last year. I know one was Waterbury.
Yeah.
And that was in a state-owned building, so that wasn't.
Well, there was one in Williston, which was also a state-owned building. That's working really well. So Commissioner Winters, you're hearing the question about how much it costs to set up the shelters. And I don't want to divert us too much into that discussion right now. But perhaps you could come back. Why don't you tell us what you do know and then we'll come back for more in-depth discussion.
Well, thank you. I'll state the obvious. It's not inexpensive to set up a shelter. We did use state properties. We were looking at state properties that we could use. The bulk of the expense was for the contractor. And that was because we had to hire someone from out of state to do it. And it included their housing and overhead and their travel and everything else required to get them here. So that made it more expensive than normal. I think that's one of the benefits of looking at this as a comprehensive program on a regional level. This sort of shelter and that sort of infrastructure could be built into the overall approach for the region. It still won't be inexpensive. It comes at a cost, but it can be done much more efficiently and cost effective than hiring an out-of-state vendor to do it. I'm happy to bring back some additional numbers if anyone is interested in where that funding went for the Williston shelter and the Waterbury shelter, but it was in the millions of dollars for a temporary shelter.
Okay, so we'll come back to that, but I think that's an important point to be made.
Is the state maintaining the responsibility to fund?
Yes.
Because it's not fair to tell a nonprofit that they have to set up $1 million shelter and not.
Well, here's, think about another goal, that reducing dependence on hotels and motels may allow for some use of monies for shelters. It's gonna be a dicey, tricky, transitional process.
Well, that's the problem we ran into last fall. We couldn't get the shelters open, so you ended up having to put people in motels. You have to have the shelter ready before you can take the people. You've got to have the upfront investment.
Right. That's exactly right. And so we'll be keeping our eye on that. Senator Douglas had a question or no?
No.
Okay, well, quick question, please, because we want to keep moving here. Go ahead.
Just based on that, in terms of the intent of not wanting to use hotels and motels, like if it's worth trying to distinguish, I think the general concern with the hotel motel program is not the use of the hotels, it's that they're outside of the system. So folks are not connected to
Totally.
the services. And so making that distinction where the goal is not to necessarily not use hotels because those can be used cheaply and efficiently if they're part of the system. And then that also allows folks to maximize investments into the solution, which is permanently affordable housing.
Right,
I think-
we got it.
Yeah.
We got it. We're good. Go ahead, Katie.
So we just reviewed B1, B2, the Community Action Agency shall have the ability to meet department's reporting requirements, including having a past history of reporting compliance, the capacity to perform services required pursuant to 2206 of this chapter, any outcome measures established in this chapter, community connections with other providers in the region, including local housing coalitions, housing providers, providers of coordinated entry, continuums of care, faith-based organizations and providers of services to individuals for older Vermonters, individuals who have disabilities, substance use disorder, or mental health condition, individuals re-entering the community after incarceration, individuals transitioning from the care and custody of the Commissioner for Children and families with children. And the ability to provide plain language communications to households receiving services. Not less than every 3 years, the department shall conduct a reauthorization review of each community action agency providing or causing to provide services pursuant to this chapter. An organization may be subject to corrective actions by the department if, within the constraint of appropriated resources, it no longer meets the requirements in subsection B of this section, or has failed to adequately meet the needs of households in its region that are homeless or at risk of homelessness. Lack of compliance may result in the department deciding not to reauthorize the community action agency. The department may review community action performance between.
Nolan.
Sorry, Director Nolan, will join fiscal. Can I ask a question? Okay, line 15, what does that mean with administrative appropriated resources? For who? For the agency, for the CAF, for the department? What does that mean? What does it mean?
It means that they're being judged on what they're doing within their budget.
Yeah, this was brought up when you were out of the room. And so then how do we say that? So is it effective use of the funds to achieve the goals? Effective use of the appropriated resources to achieve the goals?
I think that's given, isn't it? I mean,
I'm trying to sort out what this says.
you sign a contract, right? Because I assume this will be a contract, and so they're committing to operate that contract within the given resources. So I don't understand what within constrained appropriated resources means. That's
I
just,
think this is language that was negotiated between the department and community.
oh, good. Okay.
Yeah.
Chris,
We'll just hold it there.
maybe Chris shed light on it.
Oh, yes, go ahead, Commissioner.
Thank you. I can very briefly. This was a concern that was raised by the community action agencies, and we agreed with it as well. I think the language, although it's not being shared at the moment, it says if we're judging the community action agency, Katie put it well, like judging them based on whether or not they're meeting the needs of those experiencing homelessness in their area. And that just with that broad language, we will never meet the needs of everyone experiencing homelessness in the area. So we just wanted to narrow that down a little bit to, given the budget, given the resources that they have, are they meeting the needs within the constraints of that? They're not going to meet everyone's needs, but how are they doing with what they have?
Got it. Okay, thank you. That was a question we had earlier. Roger about that.
Yeah, there.
Okay,
Okay, line 18, lack of compliance may result in the department deciding not to reauthorize the community action agency. The department may review community action agency performance between reauthorization reviews and progress on any required corrective actions.
okay. I'm gonna suggest that we're gonna stop here, but so the
Okay.
next questions for Katie on this section here.
I assume that when it says the department may choose not to reauthorize, the agency could also request not to be reauthorized. If they just felt that they were being asked to do an unreasonable amount,
Okay,
they don't want to do it anymore. I assume they can opt out.
they're doing that in the beginning. So how do we put that?
Well,
Here.
I mean, these aren't state agencies. We
No,
can't
no.
require them to do this. I assume that to be reauthorized implies that they request to be reauthorized.
I'm looking behind you for an answer from the CAP.
Amy Schomer from VCAP. I am not a lawyer, but our understanding of this is a mandated activity on the part of the community action agencies, the way that Phil's written. I would defer to Katie. And that question did arise in our discussion. We did not come up with a suggestion because we couldn't figure out how to do that. And frankly, we ran out of time with the department to come to agreement about it. So it's not like it was their fault. We weren't able to do it. The other thing I just wanted to flag, especially for Senator Cummings, is that if the CAPs are not able to do the work because of the funds appropriated, you all might want to know that.
Oh, yeah.
So that's this might be an opportunity for you to get information as well.
I mean,
So having a report from the department
Or the CAPs.
or the CAP and the CAPs.
I mean, to me, if they didn't.
That does make sense. And so then so what's happening here with CAPS is that they are in a way becoming designated agencies. And so we haven't reached out and said, there's not an RFP process here. We're simply saying you're designated and you can be reauthorized. So the question is,
Can they say? we
can
don't want to be
they not be authorized?
I don't.
So
I
That
get
we
very
would-
uncomfortable.
Let me finish. We could put that question to the October 1st report. Because I think it's an important question. I don't want to let it slide. So we could put that request of if and how CAP might ask to be deauthorized or not be considered for this. We might have a mutiny on our hands, but
Well, just to announce that we have decided you're going to do this job for the state of Vermont. Feels a little too Washingtonian for me.
well, but there's a lot of discussion that's been
And as
going.
long as they are willing to do this.
Yeah,
But I also think they need to continue to be willing to do it, especially since nobody's making any guarantees.
well,
And
here's
they
what,
may find their base funding is gone and they can't do it.
well, I hear you. I don't think we should allow a CAP to say, okay, on June 30th, we aren't participating next fiscal year. Okay, we can't allow for that.
No.
So there needs to be some upfront something. And so there needs to be something in the August 1st report that says timing of and consideration for, and yeah.
I mean, we've got a timing for the agency says they can.
Yeah,
It's certified
I mean,
that, but it
if we're
doesn't-
building a budget
Yeah.
around a CAP and then the CAP says we're
Right,
not
no, I
doing
think,
it,
I
you know,
think something
forget it.
like January 1st
Yeah,
needs to be done.
Can I summarize what I think I just heard? So I'm gonna add to the October 10th report, some language about a process by which community action agencies can opt out of VHART participation. And the process for doing that gives adequate notice to the state. And I also heard that you would like notice if if the CAPs don't feel like they can do the work of VHART within their budget. And I'm wondering if I add that into the authorization section, if we have a new subsection that says the community action agencies may notify the General Assembly if at any time they do not feel like they have the funding appropriate to fulfill their duties. Would you like that or no?
I would not like that.
No, okay.
I would not like that. That I think goes through the budget process.
Okay.
Otherwise, I was gonna have, but right now I'm getting everybody and his sister at every single municipality doing that, exactly what you're saying. Not helping a whole lot. Go ahead.
I think we're wrapping up, but I have a very small question for Amy. Is there anything either in the law, that would prevent community action agencies facilitating the card to not be able to accept like donations of like furniture or money?
Nothing. It's,
Okay.
okay. Well, this has been this has been a good time. So we will start on page 11, I think we're on.